from Beaverton Pet Clinic, and this is my lovely assistant Sid and my other assistant Kiara. And today we're going to be talking about administering subcutaneous fluids at home. Sometimes with certain conditions you'll have to be giving fluids at home rather than bringing them in here because it can be a lot less stressful on the animal. So first I'm going to just talk about the equipment that we would normally be sending you home with. We have our 1 liter fluid bag, and each line represents 100 milliliters. The lines between the numbers represent the 50 marks. For example, if you have to administer 150 milliliters, you'll go to the line right between the 1 and the 2. And of course, the second time that you administer fluids, you would go down to the 3, and so on and so forth. And your doctor should be providing you with the necessary equipment, including the needles. And so what we like to do is have the pet on a table surface and have your bag up high where the gravity can help with the flow. Sometimes you can use a shower curtain rod or use a hanger on a door, things like that. So when you're about to get ready to do this, you'll want to grab the skin that's right between the shoulder blades. And bring it up until it makes a tent. You'll use your finger to find the flat part or the divot, and that's where you're going to be inserting the needle. Okay. And with the bevel or the open side facing up on your needle, you want to go in as parallel as you can. That way you can avoid hitting any... Sorry, sweetie. Avoid hitting any muscle or bone. Ideally, you want to have the needle about halfway in, but of course all the way in would be okay as well. Once you have the needle secure, you're going to use the wheel to turn the fluids open and going. Yeah. And you definitely want to talk to and pet your cat or your dog, whoever's getting it. Try to comfort them as much as possible. I know. Sometimes having treats at the end of the process can help them to not dread it each time you have to give. And of course you want to have slack in the line so that there is room for movement. And today we're just going to be going to the 100 mark. So now we're at the 100 mark, so before you take the needle out, you'll want to come back to your wheel and roll it down so it closes the line.
Oh, she already pulled it out.
Oh, and she pulled it out for us, but usually you'd like to pinch the skin where the needle is inserted and pull it out and just put a little bit of pressure right where it had been inserted. That way it doesn't leak all over, because leaking is normal and a little bit is fine, but we don't want it fully seeping out. And this can help tremendously with stress levels, being able to do this at home so that they don't have to come and see us all the time and dread coming to us and dread being put in their carriers. Thank you for tuning in, and we hope to see you soon at Beaverton Pet Clinic.